After failing to reach a deal between Catholic Health and the CWA, a strike at Mercy Hospital is about to enter its second day. Good evening, everyone. I'm Mary Alice Demler. Scott is off tonight. Well, union members are still outside the hospital in South Buffalo 17 hours after it all began. We have team coverage for you this evening, starting with Channel 2's Rob Hackford, who is live with more on what's next for negotiations. Rob?
Yeah, Mary Alice, unsurprisingly, the CWA says its 2,500 local members involved in this dispute are prepared to continue this strike for as long as it takes to get a fair deal from Catholic Health, although there is no date set for when negotiations could resume. Catholic Health CEO Mark Sullivan insisted today that what the CWA was looking for, he presented in the last contract proposal that came about 3 a.m. Friday morning. CWA Area Director Debbie Hayes, however, fired back and said a solution for staffing, a top priority for the union, wasn't presented until the final hours, and ultimately they chose not to delay and continue their strike. Hayes added that it's not uncommon to have a cool-down period after a strike begins, after which negotiations could resume. How long that period could last, however, remains unclear, but if federal mediators get involved, talks could resume any minute.
I want to be very, very clear. We are ready, willing, and able to get back to the bargaining table. We have federal mediators involved, and if the federal mediators call us and say, I need you back, we'll be back there.
We are in the middle of working with the Department of Health. We're in the middle of stabilizing the staff here at this facility and the other Mercy Hospital facilities. And we want to be back at the table, but our number one priority that was thrusted upon us is to ensure we have safe patient care at Mercy. And that's a priority of everyone at Catholic Health.
Well, Mercy Hospital reportedly has about 200 patients still receiving care, with a couple hundred replacement workers coming here that were hired by the hospital to take care of those individuals. But this hospital isn't the only one being impacted by this strike. There are several other impacts, and tonight we have Channel 2's Dave McKinley on that story. What's the impact like, Dave?
Well, those hospitals are getting busier, Rob. More visits to their emergency rooms, increasing waiting times there, and of course raising concerns then about the capacity of those other hospitals as they take on additional patients. Evening falls at ECMC, the area's largest hospital, which also serves as the regional trauma center. It's known to get busy around here. That can be especially true on Friday nights. This is just one of the hospitals where ambulances are being diverted from South Buffalo Mercy, which asked that patients be taken elsewhere in advance of the strike. And even prior to the strike, ECMC spokesperson told us that through September, admissions were already up 11%. While things are manageable now, there are signs like this triage tent set up outside the emergency department that indicate that they are prepping if things get overwhelming. We found similar tents set up outside of Buffalo General and Millard Fillmore Suburban Hospital, both run by Kaleida. Adding to the load are the measures taken by Catholic Health prior to the strike when it constricted services such as maternity and inpatient elective surgeries in an effort to reduce the number of patients at South Buffalo Mercy, patients who are now seeking care elsewhere. Kaleida says as it receives more patients, it's also ready to move patients between its hospitals in a load balancing effort similar to the one it deployed during the peak of the COVID-19 pandemic. And of course, Catholic Health is not exempt from this, as its staff at Sisters and its other local facilities are also dealing with more patients as a result of their colleagues being on the picket lines in South Buffalo. It's a situation that only figures to intensify the longer the strike here goes on.
What we are looking for is for the hospital and for the unions to sit down and negotiate as quickly as possible, because at the end of the day, we want to make sure that everyone in Buffalo who has a healthy needs to go to the hospital gets the attention that they need.
I will give you a quick for instance here. On Thursday, which was the day after they suspended labor and delivery services here at Mercy, an additional 12 babies were born at Oshai Children's Hospital, and they expected a similar number of newborns to arrive there today. Babies who were all due to come into this world here in South Buffalo instead. With Rob Hackford, I'm Dave McKinley. We'll send it back to you, Mary Alice.
Rob and Dave, thanks very much for your reports. Well, we wanted to ask you our question of the day. How worried are you about patient care during the Mercy Hospital strike? A lot, a little, or not at all? Well, right now, folks are pretty much split down the middle, about half saying not at all, and the other half are somewhat concerned. Let us know how you feel. Just go to WGRZ.com/vote, or you can vote on our free 2 on Your Side app.